Well, we turn now to Dr. Darien Sutton, looking at a couple of the medical topics on the minds of our viewers. So many questions out there. One of them, Dr. Sutton, Omicron. Tell us about the symptoms and when should parents know to take their kids to the hospital?
Yeah, so unfortunately, there is no clear way of telling whether or not you have the Omicron variant, whether or not you have the Delta variant, the flu, or just the common cold. Right now, in the setting of high rates of transmission, my suggestion is treat it like it's the COVID-19 until proven otherwise. Put on a mask, isolate yourself, and get tested. And your second question of when to take children to the hospital, first off, I always tell moms and dads, you know more about this child than I do, but there are some signs that I'm looking for. Dehydration. Does the child look really dry? Are their mucous membranes or their lips really dry? Is their fever coming down appropriately with medications like Tylenol or ibuprofen? And then also, how are they breathing? Are they grunting? Are their nostrils flaring? Are they belly breathing? Those are some of the signs that I figure out whether or not a child is in distress.
Such important things to look out for. And, you know, another question from one of our viewers said, recently over the holidays, I've gotten gout. What causes gout and is there a cure? And, you know, we were talking in the break. You said a lot of people just don't even know they have it because they don't know what they should be looking for.
And it can be terrifying. The pathognomonic textbook presentation is a patient that wakes up in the middle of the night with a painful red, hot, big toe, and they don't know what's going on. And we call that an inflammatory arthropathy. And essentially, it's due to a chemical called purines in the blood. And purines can be found in foods like shrimp, liver or organ meats, as well as beer yeast. And unfortunately, some people are just prone to getting it more than others. If you have symptoms, it's important to see a provider to rule out infection. And you also might need treatment. It can be something simple like Motrin or ibuprofen, and some patients require prescription medications. So just check in with a medical provider if you think you have those symptoms.
Can be scary, but could have some simple solutions.
Absolutely.
It's so good that we got that question because we're so inundated with information about COVID, but of course there are so many other things out there that people are dealing with too.
Absolutely.
And you can submit your questions to Dr. Sutton on his Instagram at dr.darien.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.